learn some new things. I'm going to share my screen. And get started. Okay, wanted to share some ideas to help preschool and school-age kids cope with current stressors, and to share some of the information that we know about how to work with kids in outpatient therapy related to anxiety or other stressors, but wanted to bring some ideas about things that parents and teachers and other providers can use at home. So thinking about very young kids, we know from research about a variety of different stressors that preschool-age children can demonstrate reaction to stress through a variety of behavioral forms. Kids this age can demonstrate separation anxiety, increased clinging behaviors, and nightmares. They can have difficulty with appetite, and we see some regression of skills related to speech difficulties and also loss of bladder or bowel control after that's been achieved. We also see kids demonstrate stress through increase in temper tantrums and even aggressive or refusing behaviors. Kids who are school age tend to also show behavioral changes related to stress. We can see physical symptoms like headaches or stomach aches, sleep or appetite disturbance, a change in their ability to do independent things in terms of demonstrating independence in chores or independent learning. We can also see kids withdraw from peer or interest in activities they used to enjoy. And we see an increase in acting out behaviors, including demonstrating irritability or aggressive behavior. And so we start off with kids to try to help them understand about how stress affects their body. And we teach kids about their body and these physiological responses to stress in a lot of different ways. And we also try to improve their emotional vocabulary so that they are able to identify their feelings and better communicate their needs. So some of the examples, we do specific teaching for kids about their different hormones, about adrenaline, about what stress feels like in the body and how they might be experiencing a stomach ache, and that can be related to stress rather than being sick. And so we start with this education because it helps kids be able to understand why we want them to learn a variety of coping skills and relaxation skills later. And so highlighting how their lungs feel and how their heart beats more quickly when they're stressed gives them an understanding about some of these physical symptoms. We try to help them understand about fight or flight or freeze and what that means in terms of muscle tightness, heart rate increasing, and also what it feels like to relax, and trying to give kids concrete ways to understand these physical sensations can be a helpful way to teach them to be able to use and understand coping skills. So some of the Some of the tools that we use are to review with kids and really expand their emotional vocabulary, and then teach them to describe how big their feelings are. So we have a lot of different strategies that use faces and being able to think about, which is bigger, angry or frustrated. So thinking about the size of their feelings, how they work in concert with one another. We use a variety of facial expression kinds of art activities, and also labeling emotions by modeling. Adults can do a good job of using this time to name emotions that are hard for kids to figure out sometimes, exactly how they're feeling. And so a good model is a helpful way to understand that. And also talking about how characters are feeling in books or movies can be a good way to make sure that young kids through school age have a good emotional vocabulary to describe how they're feeling. I wanted to share an example of a resource, and this is available on Amazon, and is really designed for parents to use at home. But it's a good one, and it provides a nice framework for the kinds of coping skills that we find helpful for preschool and school-age kids. So in this resource, and theoretically, there's a variety of different categories of coping skills that can be helpful for children this age. So I've broken them down here. So we want to help kids understand that a coping skill is anything that helps them feel better when they're feeling upset, and so they can fall in different categories. So calming skills really help you relax. There's distracting skills that you can use to get your mind off something that is upsetting. Physical skills really help you with manage energy in your body. And then processing skills can help you when you're feeling upset to think and feel differently about the problem. And so I've shared a variety of coping skills in each of these domains. So calming skills, examples would be things like deep breathing or other relaxation techniques, progressive muscle relaxation, imagery techniques, kids using their imagination to take them out of the moment, and then mindfulness techniques, which are a form of meditation that focus on use of the 5 senses to help kids focus on the present moment. And each of these have a good research basis in helping kids learn to calm down. So a couple of examples of what this could look like for preschool or school-age kids would be to try to teach them a concrete way using items to be able to practice the skill correctly. So for this one, we ask kids to lay on their back and have a small object that they place on their belly, and then to watch the item go up and down slowly. This teaches kids how to focus on diaphragmatic breathing rather than more lung breathing, which is more hyperventilating. And so teaching kids to do nice slow belly breaths is a way to promote relaxation, but without a visual cue, it can be hard for young kids to understand how to control their breathing. So using a strategy like this can be helpful. Other strategies are using a visual cue and modeling to teach kids how long they're supposed to breathe in, how long they're supposed to hold it, and how long to breathe out. And so they put their finger on the triangle to teach this, and then they practice it a few times. For many of these skills, the best way to teach is first model, then practice, and then provide an incentive or a reward to practice them daily until they feel more natural. We want kids to be able to be very comfortable with skills so they can access them when they're distressed. Another idea is the idea of learning to do deep breathing by blowing bubbles, or some other concept that helps kids know what that feels like to blow out slowly. If you blow out too quickly, then the bubbles will pop, but if you blow out nice and slow, then the bubbles, they can see those. Other examples are to breathe in like they're smelling flowers, and to breathe out like they're blowing out candles. And all of these are ideas to get very young kids to be able to do more slow and relaxation-based breathing. We have a variety of mindfulness activities that can be very fun, and kids are willing to do them. The focus for mindfulness is being able to engage one of the five senses or multiple senses, so that kids really focus on the present moment and are not thinking about the past or the future, but are really paying attention to how things feel right now. And so a lot of these are fun and engaging, and kids really enjoy them, and they provide a calming strategy that kids are willing to use. So we have kids who have a sandbox or a sand tray, even in their home. The use of kinetic sand or other things they can dig their hands in is great. Listening to nature sounds. Kids are very willing to listen to the sound of the ocean or sound of birds, and just concentrate on that for a few minutes can provide some nice calming. Kids love making slime and putty and Play-Doh, and focusing on using their senses is a great way to promote a calm state. Kids can engage in the use of coloring sheets, and careful coloring provides a mindfulness-based activity. We encourage kids and parents to gather materials that the kids identify as feeling good to them, and trying to make a cozy corner in their room or at home, and making this a place that kids want to go when they're distressed, and that they are excited to use their skills to calm down and be independent can be a very positive thing, rather than having them go to a place and not have anything to do, like a timeout. We certainly see kids being willing to use cozy corners, and families willing to create those. Another technique that it has a mindfulness background is the idea of teaching kids to look around their surroundings and name 5 things that they see, and then touch 4 things to feel their texture, and then listen for 3 sounds, and then smell 2 things, and finally taste something that's tasty. So walking kids through these kinds of activities that are very short can be a nice way to take a brief break and help them get centered again if they're upset or dysregulated. Other examples, having kids focus on sounds that they hear and they can identify, thinking about what sounds do they hear from inside their body and outside their body. And parents can guide children to a mindfulness activity for, it doesn't take very long, just a few minutes to be able to have some of the calming impacts. We also see Kids being able to use their imagination in a relaxing way. So prompting kids to close their eyes and think about their favorite place, and then add as many details as they can. The more rich details, the more calming sensations kids are likely to feel. And walking kids through a imagination session about a shared family memory or a favorite place can be a helpful way to teach them this skill. Kids can also be guided to imagine some of their most pleasant things, and the guidance is, as long as there is a lot of detail, then kids get the benefits of relaxation. So describing their favorite holiday, their favorite food, things with lots of rich details, and parents engaging in that along with them can have a calming effect. There's a strategy called progressive muscle relaxation, which is used in the treatment of stress and anxiety routinely with kids and adults. And so if you, there's different YouTube videos of strategies, and you can find resources. But basically, we tell kids to start at the top of their head and go through and tense and then relax their muscles one at a time. They can do this when they're laying down or seated, and parents can do it with them to tense their face muscles and then relax for about 3 seconds. And so all the way down to their feet takes about a minute or two, but can kids can really feel more relaxed in their body, and so they can walk through this sequence. Parents can draw a picture of their body and walk through a checklist, but this is a simple relaxation exercise that kids can be taught. And so a variety of different calming skills. Now we're moving on to distracting skills. So these are for when a child is worried about something and is looking for a way to get their mind off it. So offering things that use their imagination or items that distract them can be a good way, and can also be part of their coping skills repertoire. So encouraging them to write a story or do something else creative. We have kids who enjoy working on word searches, and that could be part of their materials in their cozy corner, things that are ready-made and can help get their mind off what they're upset about. We encourage kids to think of getting their minds off things that are stressful by being creative and doing activities. Getting busy with something is a good way to help them with stress. And so thinking about the next category, physical coping skills. These are using small and big muscles to move their body and get a nice mood boost with endorphins, and focus on something that's more interesting than feeling stressed. So lots of different ways that kids can have access to stress balls and Play-Doh. Those are things that can be in their cozy corner. Kids, I've known kids who really like popping bubble wrap and being able to have a small box of sand or something else can be a really nice thing to get their mind off their stress. Sand tray. Young kids may need some support, but older kids can certainly get excited about making things and keeping their hands busy as a way to cope with stress. Helping kids be able to choose from a menu of fun exercises that they like to do inside and outside is a great coping skill to have on hand. Being able to to go outside and move and swing, teaching kids simple yoga poses. We really like Cosmic Kids Yoga on Prime Video as a nice age-appropriate yoga teaching. They're about 20 minutes for preschool and elementary school children. And then the last area are processing coping skills. So these are designed for kids to be able to get some help with their thoughts and feelings about a problem or a stressor. So there's a variety of these kinds of skills that I wanted to review. Cognitive strategies, which would include some things like reframing or perspective taking, journal writing activities, art activities, and practicing gratitude would all fall into processing coping skills. We've seen some helpful therapeutic ideas about making a COVID-19 time capsule as a way to help kids make sense of this time. Some of the examples are, creating some art related to this, capturing their time and their life during this time, and then even interviewing others. And focusing on what they're excited to do when this is over with. We also have ways to help kids with using concrete strategies if they are worried or upset about something. Sometimes it can help kids to be able to draw or write something and then put it away in a physical location. That's a way for them to be able to make sense of it. We help kids track the things that are distressing to them, to think about cause and effect, and using cognitive behavioral strategies to try to think about why situations make them feel more or less distressed. Other cognitive behavioral tools can help with changing perspective, helping kids make lists of things that they can and can't control as a way to shift perspective into more positive strategies. We routinely teach kids about their self-talk and helping them identify when they are having more negative self-talk that is distressing, and being able to switch that to more neutral or focused or positive things. So an example would be if a child is frustrated that they're not learning to ride a bike well, and they're saying they're not good at this, encouraging more positive self-talk would be to coach them to say that they're just learning how to do this and that they just need more practice. Positive self-talk is found to help kids be able to be more resilient and cope better with stressful situations. So modeling that and encouraging kids to challenge their self-talk is a helpful practice. Thinking about physical coping skills and how they can focus on the present moment is a good strategy. Let's see. Oh, I put some other physical activities in here that are fun. Making an obstacle course if kids are stuck inside or outside can be a helpful one. Good. So thinking about what some of the resources that we found to be helpful, some of our national organizations have put together really nice resources. The American Psychological Association produces a variety of child-friendly books about different situations and feelings that can be very helpful. PBS Kids has a variety of different really good videos with Sesame Street up through older kids about talking about coping and resilience and COVID-19 specific information. The CDC has put together some really nice things for kids. I wanted to share the Coping Skills for Kids curriculum that we found helpful that's available on Amazon, and the Cosmic Kids Yoga. And then there are a variety of apps like Headspace that have mindfulness and meditation things really down to age 3 or 4, all the way through adulthood, that can be very helpful. And then one resource I've really liked is Sitting Still Like a Frog, which is available in download, and it has a variety of short activities for kids to do. So let's see if anyone has any comments. Thanks so much. Okay. We will make the PowerPoint available and the recorded version available. Thank you very much.